Excellent. My name is Alixe. I am Assistant Director of the Ontario Sport Support Unit, and I'm happy to be able to introduce today's webinar, which is part of the OSU, Ontario Sport Support Unit Patient Partners Working Group webinar series, where our patient partners have basically been identifying issues that are major issues to address and how to set up discussions around them. And today, as you can see from my PowerPoint, is around patient partnership and COVID-19 research. So obviously a very current and relevant issue, both in Ontario, where we're based, and also in every other jurisdiction around the world, particularly places that have tried to sort of build patient partnership into the process. Before we get started, I did want to quickly find out how on earth I stop sharing my screen. There we go. I did want to quickly do land acknowledgement. Even though we are doing this as a virtual webinar, I am sitting in Toronto, and so I wanted to just acknowledge that this is the territory of many nations for the past, from including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and Haudenosaunee and Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. And it's covered by Treaty 13 signed with Mississaugas of the Credit and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. We are very grateful to be able to use this land that is the ancestral home of so many different First Nations. With that, I'm going to do a quick introduction to the fact that we do have three excellent discussants to talk about the work that they're doing and the involvement they've had with patient partnership and COVID research. We have Alixe Ménard from the Patient Advisors Network, and also one of our founding members of the Ontario Sport Support Unit, Maureen Smith, who works with, amongst others, the Cochrane Collaboration and is the co-vice chair of our Patient Partners Working Group at the Ontario Sport Support Unit, and Rebecca Gannon, who is a researcher at McMaster's Aging, Community and Health Research Unit, and who has been doing a significant amount of work in bringing patient partnership into the world of research that they're involved with. And just to get us started, I'm going to ask Alixe, Maureen, and Rebecca to unmute. And Alixe, if you can just do a very quick introduction to yourself and sort of why this is an area of interest for you, and then we'll do Maureen and then Rebecca.
Okay, good afternoon, everybody, and thanks for the opportunity to talk about all of this. Just by way of background, I started in 2015 on my very first research project as a patient partner with Dr. Sam Biancourt, developing prompts for patient-reported outcome measures for patients who are treated and then released from the emergency department. The reason I'm raising that is because I stay a member of his team and have done, even though the research was completed in 2019. And we subsequently co-authored an article together on on the patient engagement for that work. And now we are working on tools together that are a result of that work. So the COVID experience didn't cause a hitch. It did cause us to go virtual, however, because we regrettably couldn't meet face to face. So I wanted to raise that. And I think that in part that my engagement there was a result of a long-term trusted relationship that I developed with Sam and with the team. So I wanted to make that point. And then I just wanted to touch on some of these sort of missed opportunities, because I know that there were research calls which did not include patient partners. So I'd like to now tell you a sort of a related story about that briefly. I'm also on the local health authority citizens panel here. And when they stood up the COVID planning tables, there were no patient partners involved either. All of a sudden we were the outsiders, and then by towards the end of June, the decision maker came and addressed our panel and explained that there had been no time to include us, to orient us or onboard us, and that our presence would probably slow things down in the time of a crisis, and that was the rationale. And I believe that that lack of involvement allowed for some draconian visitor policies that have caused harm. I have heard this same excuse in the research world, not just during COVID, but at other times, and I think it's more acute during this time. Patients don't know enough, they take too much time, etc. But I'll tell you, with the council, within 24 hours of her coming to address us, I was belatedly put on a COVID table, and I immediately enlisted my colleagues on the council to provide principles and priorities around reopening elective surgeries. We were all experienced and we moved really fast, so we delivered what we wanted to within 48 hours. The point here is that we totally contradicted the assumption that we don't know enough and we take too much time. And while this example is sort of outside research, the excuses are similar, and I think they simply don't hold water. As the crisis deepened in April, I started to be contacted to be involved in COVID-related research. But those invitations came primarily through people who knew me already and knew what I could bring to the table. So again, it was based on the trusted relationships. So I'll end this with 2 points. The first one is that long-term relationships are the bedrock of ongoing patient-partner involvement. And the second is that there is no excuse to exclude us. In fact, this may cause faulty research, in my opinion. So how do we entrench patient engagement in research going forward so this doesn't happen where we're ignored? And how do we prove its value? And I'll stop there. Thank you.
Great, thanks, Elise. Maureen, you can just quick intro.
Yeah, hi everyone. Maureen Smith from Ottawa. So first of all, thank you for joining us. We seem to be having a feast of webinars. So happy that you chose ours to attend, and hopefully we offer some food for thought for you. So I'm from Ottawa, and I've been involved in patient advocacy work for the past 20 years. And the last 5 years, I've been a patient partner on a number of research studies. I'm the co-vice chair of the Ontario SPOR Unit's Patient Partner Group with Lucy Langford. And I'm also the chair of Cochrane's Consumer Network Executive. Cochrane is a global independent network of researchers, professionals, patients, caregivers, members of the public interested in evidence-based healthcare. And finally, I've been on the board of the Canadian Organization for Rare Disorders for the last 14 years. My interest in patient partnership stems from a rare disease diagnosis at the age of 8, involvement in many clinical trials, a longitudinal trial that lasted 10 years of my whole childhood, and my lived experience as a person who depends on the healthcare system. And COVID-19 research is relevant for all citizens. There's no one who isn't impacted. In my own case, I'm immunocompromised and my husband is undergoing chemotherapy. Therefore, we're definitely feeling the impacts of COVID-19. And I'll keep the rest of my statements for when Eddie asks the 5 questions that we've been given. I'll stop there.
Great, thanks. Rebecca.
Sure, thanks. So my name is Rebecca Gannan, and I'm an assistant professor in the School of Nursing at McMaster University. As Eddie said, I work closely with the Aging, Community, and Health Research Unit at McMaster. I'm their patient engagement lead. In that research unit, we're focused on patient and caregiver partnered interventional research to support older adults and their caregivers. And I'm also part of the MIRA collaborative. Sorry, I should say I'm terrible. Researchers are always using abbreviations. I'm part of the McMaster Institute for Research on Aging, the Collaborative for Health and Aging. And so we're one of the centers that is part of the OSU network of centers. And our focus is on aging research and building capacity in patient-oriented research on aging. And so in that capacity, I'm the co-lead of a working group that's looking to advance the science of patient engagement. And when I say patient, I appreciate there's a comment, a couple of comments in the chat about caregiver engagement, and certainly it is meant to reflect the wonderful patients, caregivers, and members of the public that are partnering with us in our various studies. So I might just stop there in terms of who I am, and I'll look forward to discussing the questions with the others.
I will follow that up, Rebecca, with the quick clarification for those who are not based in Canada or are not engaged with the strategy for patient-oriented research. The way patient is defined in Canada is, when it comes to patient partnership in research, is to define patient as including caregivers and family members as a way to try and make sure that we include people who have some experience, lived experience of working of the system that they're engaging with. So that's a general thing. This is going to be a discussion across, let's be honest, these three people who are more interesting than I am, about what they've been experiencing around research in COVID. And so I'm going to sort of throw a few questions at them and sort of have them discuss amongst each other, and then if there are questions or comments that come up in the box, I'll also try and bring those into the discussion as well. But the first one is around what people's experiences were around patient partnership when COVID hit. So how did it fit into the system that was working? Did you see changes in the way that occurred? And Maureen, I'll let you kick us off with that one.
So prior to COVID, my experiences were very positive. I work with a great group of researchers. I realize that I'm very fortunate about that. And I thought we had reached a turning point in patient engagement and research. I really thought that, we had made huge advances with the strategy for patient research oriented, that we were looking to organizations and, in the UK, such as Involve and the Patient-Centered Outcome Research Institute in the United States, PCORI. We had all these materials. There were articles on patient engagement. I just couldn't keep up anymore. I thought we had reached this turning point. And when COVID struck, I realized that, well, it really was by invitation only. And I think our invitations got lost in the mail. So I was very fortunate. I was invited. I was contacted by 3 researchers when the call went out from CIHR for grants. And one of those got funded. But basically, I think that patients were left out of a lot of the COVID research, and that's really unfortunate. And I think that's the sentiment in many countries. So I was on a webinar on June 5th with the International Patient and Public Involvement Network in Healthcare, and there were a lot of Brits, people from the UK on that one, and 61% of the webinar participants felt that patients were less engaged in health research at the start of the pandemic. And it'd be interesting to take another pulse. We're a month past that and see if that's changed. And I think that first wave of research went out, and there was no requirement for patient engagement on it. It wasn't a SPOR, they weren't SPOR grants. And we found out that relying on the great researchers who engage with patients all the time, and which is what we were basically doing, was probably not enough. So I'm gonna stop there, but I think it exposed the fragility of our patient engagement, and it was a huge wake-up call for me, because I thought we were further along. I'll stop there.
Great. I'm going to pass that over to Alixe, but firstly I'm going to launch a poll for the exact question you asked, Maureen, so that people are able to now vote. You should be able to see the options around whether the engagement partnership in research has changed since the advent of COVID-19 pandemic. Whether it's happening less, happening more, about the same, or we're not sure. So we can get an understanding from people who are involved whether they think there's change. It'll be interesting to see it's different. If it's different from the Involve BPI, International BPI network session. So I'm going to give it another 10 seconds just to see if people want to add any more of their thoughts. Okay, great. I'm going to stop it there. I should be able to share the results of this. There we go. So you should be able to see now 55% think that it's less engagement, 5% think there's more engagement than there was before, 17% around the same, and around 22% don't know. So very similar, I think, to the one that you heard at the BPI network, Maureen. So we can move on to Alixe. And Alixe, what are your thoughts on how things have changed since the advent of the pandemic?
Well, for me personally, not much has changed, but I am aware, as Maureen said, of the calls that went out for research specifically dedicated to COVID, and that there was very little patient partner, if any, involvement, and certainly no requirement, which I think is really sad in a lot of ways. I think my guess is part of the assumption was this is a pandemic, we're the experts, we need to deal with this. Failing to realize that the only way to deal with any of this is actually to engage the public at large. We are required to do all of these things: masks, distancing, staying at home, etc. So all of these things that we were experimenting with that become part of the research, and then we are not involved in the research because somehow we are being acted upon and not being acted with. And I think that's my sort of observation. I think they went back to the old mentality of we're the experts and you're the people that we're acting on behalf of or for. So I'll just leave it with that comment.
Okay, I might jump in there then. And I mean, I've seen some similar things. I think some of the COVID calls and that I saw going in and the grants that were going in, there were missed opportunities for patient partnership. I think in other cases where there were already established relationships, so I know as well, I'm involved in a couple of projects that have pivoted for COVID funding calls, and where there were established relationships, then that was able to continue. And so there was that capacity. In other cases, this isn't necessarily about the funding calls, but we have a number of projects through our research unit and that are patient partnered. And we certainly had to pause some activities, and I'll explain why some of those activities paused. So in some cases where we had cross-cutting sort of steering committee actions, those activities we were able to continue in a partnered way. We also tend to have a layered governance structure where we have sort of a cross-cutting, cross-site perspective, as well as local community advisory boards. And those boards, the purpose of them is to guide local implementation. So for some of our study sites, for example, we have a large study. We were just, I was co-presenting with a patient partner yesterday with through Diabetes Action Canada, and some of the sites have said all research activities have to stop. Therefore, it didn't make sense to continue to engage. We have a certain sort of structure or plan for engagement, and if the site isn't continuing to deliver the intervention, then it seemed like we would be engaging people, but not actually honoring the value of their voices because we couldn't actually act on it. In other cases, the sites were able to continue and we were able to engage. So I think there's a bit of a mixed bag in my experiences as to how it went. And I would have to say that there's a study that I'm leading right now, and it's about engaging older adults who are living in communities facing a lot of health inequities, and we've really grappled with it because there are our engagement activities. There in lots of ways we could virtualize that, but we worry about sort of the digital divide and access to technology. So we have done some reaching out to our partners, and many say, yeah, and in fact I have more time and I'd love to connect and engage and inform, and others have been quite silent or have said I'm not able to engage right now. And so I think it's a matter of negotiating roles and negotiating preferences for engagement and seeing what kind of capacity people have given the other things that they're managing in their lives. But I certainly support everything that everyone is saying. I think there have been some missed opportunities. I think lived experiences are valuable now more than ever. And an example of another study that we have that was funded through also, a few years ago, we're in the knowledge translation phase of that study. And we were having a discussion around the insights around transitional care for older adults. And one of our caregiver partners said, I'm not sure if my insights right now are as relevant, because I didn't experience it during COVID. And so what we ended up deciding to do was to engage her very valuable perspective that, as she always has, and engage someone else who had a more, or it was actually a couple who have had more recent experiences with that. So I think it's trying to figure out, how to navigate that and acknowledge that COVID is really on the forefront of a lot of people's minds, and it's affecting everyone's day-to-day lives at this point.
Great. I want to sort of get a bit more into this concept of missed opportunities. Both you, Rebecca, and Alixe, you mentioned this as there are things that we haven't necessarily done. Can you give some examples of where you've seen opportunities that we hadn't really grasped, but perhaps could have? At least maybe you can start us off with that. You're muted right now. There we go.
Yeah, okay. So, so I haven't, other than the CIHR calls, I haven't actually seen any obvious missed opportunities. And like Rebecca said, those opportunities that I'm already on and involved in, either as an individual or through the Patient Advisors Network, PAN, they all did this sort of rejig because of COVID. So there was the need to sort of accommodate for the reality of the times, both in the content and substance, and also in how we moved. Although I've got to say, a lot of the work that I've done in research has been virtual in any event. So it wasn't a huge change for me personally, although I do miss the meetings, I've got to say.
Yeah, Rebecca.
Well, I think that some of the submissions that I saw going in, I mean, it wasn't necessarily explicit in those calls. There wasn't an explicit ask around patient partnership. And I think if people aren't necessarily expected, there are going to be people who embed it anyways, because that's how they usually, they're sort of regularly involved in patient partnered research, and others will not. Because I think when we were seeing more calls around patient partnership or patient engagement, then it was forcing some to really think more about how they were doing it and were they doing it well, and demonstrating, sort of best practices in engagement. And when you see less of that in what the guidelines are for calls, I think sometimes then you see less of it in the limited time space, or or the word limits or page limits in a proposal. So I guess I would say those are sort of missed opportunities in that way. I also think that, to be quite honest, I think a lot of people grapple with it. All of us, as researchers, are also dealing with this new reality. I think sometimes our partners, the time issue is not on the side of our partners. I think the time issue is sometimes about whether we have time, not that they slow us down, but just, we're always working frantically to deadlines, and it's, any additional pieces, the partnership piece takes time and investment, whether it's with patients, whether it's with our stakeholder partners, whatever capacity you want to look at, clinicians. Like, we have had challenges engaging, clinicians for good reason, decision makers for good reasons. But it just, our ability to partner is challenging in this context. I think that the study I was giving the example of, where we reached out to our partners, almost all of our patient partners said, yeah, absolutely, we are happy to proceed when you're ready to proceed. Not all of the other partners, the community stakeholders involved, have that same ability.
Yeah. Maureen, do you have thoughts on?
Yeah, I think the greatest missed opportunity is not fully explaining to researchers the role of the patient in the research partnership. So we've heard a lot about, patients are not at the decision-making tables. There's been a lot about that, because there's a lot of decisions being made very rapidly. And that's very true, and that's very important. But what goes to those decision-making tables? Evidence-based medicine. This is what they're considering, and this is what our public health and our government's been telling us for 4 months now. We're basing everything on evidence-based medicine. The foundation of evidence-based medicine is research. And we need the patients and the caregivers and the public, in this case, to be at the table to decide what are the priorities in research, what are the outcomes that are important to us. That opportunity has been missed. So one of the researchers who I spoke to said to me, Maureen, all we're doing now is we're responding to the decision makers. We've got to get the stuff out quickly. Well, There's 38 million decision makers in Canada, either making decisions for themselves or as a surrogate for somebody else. Many of the decisions that they're making are not the traditional decisions where they would be discussing it with their family doctor or with their specialist. They're actually making decisions in their home. You know, am I going to stay 2 meters away from people? Am I going to wear a mask? Am I going to, you know, maybe take an experimental drug that I've heard about? And this is kind of flipped the whole decision making, because we're really making it our own, and the impact of those decisions are on our entire society and on flattening the curve and everything else we've heard. So I think that an organization like CIHR, which, you know, leads patient engagement with their SPOR, could have a statement out, you know, you have to be like really crystal clear and explain it, that we are part of that research system, and we've been part of it now since 2011, and we need to be continue to be part of it. And I mean, let's just be frank, patients cannot initiate the research. If it's a funded research in Canada, they have to be part of an institution. So this invitation only is really true. But the point is that we've done very well with invitation only in the last years until this happened. So I think a really good understanding that we are decision makers and we're making very important decisions, and what our role is in that foundation of research was kind of missed. And when I hear about the people talking about patients not being at the decision-making table, that's pretty clear to people. People understand that right away. If they're making decisions, we should be there. But the decisions are based on research, and we should be involved in that research too. And now we're going to have years of research. So it's not too late to set the reset button and make sure that we're in there selecting those priorities. And what is it that's going to, because we're in for years of research. Oh, I'll get off my my high horse, but I really feel strongly about that. The understanding of how important our role is in shaping the research, and I think that's my biggest missed opportunity, is that's maybe not so clear, and that we've never had a time in our history where more people are impacted by research than we are with this pandemic. Every single person in Canada is impacted. And yet our involvement has gone down when it should be going up.
It's a very good point.
And Maureen, I might just jump on, like, I agree, like in terms of engagement and priority setting, I think one of the things that I've heard, and a little bit informally, is that it has exacerbated the issue of the last minute reach out. Can you provide a letter of support to some of the existing partners? And I know, you know, that I see you both nodding, and I worry about that, because it does take time to build those trusting relationships. It does take time to hear, integrate ideas, all of that, and again, not time saying that, oh, these partners, you know, take so much time, but it's really, you know, being thoughtful about doing that and giving the space to allow for those insights to really shape the process. So I worry about that a little bit, and I do worry a little bit about people who aren't already at the table. So we know, you know, that partners tend to be reflective of certain characteristics, and it's not necessarily the broader lens, you know, in terms of society and thinking about determinants of health. And I think this is again exacerbating that issue. It's making it worse. It's making it harder to engage those people who may experience barriers to engagement. I'll turn it over to you.
Alixe, you wanted to jump in?
Yeah, I wanted to quickly jump in because, you know, Maureen's point about us being invited in, that's the big weakness, actually. And so there's two ways to look at that. One is to embed in some kind of policy that we be part of it. But why can't we be those who initiate research? I don't understand why that's a barrier necessarily. There should be a way where we can set research priorities and initiate the kinds of research that we think is critical. We wouldn't be doing all of the research. We'd be doing it together with people who are professional researchers. But I would like to see us think about that.
That's excellent. Maureen, I want to pick up on something that you said about the fact that this is something that is not, we're not stopping our COVID system right now. We're stuck with COVID for a little while. Have you seen changes, even in the 3 to 4 months that we've been sort of living with COVID, have you seen changes in how patient partnership has evolved over that time? I mean, I know Alixe mentioned the idea that she was involved with online versions of engagement already, but what has your impression been as to how we've been able to move forward with patient partnership in this?
Right. So I'm keeping my eye on the international scene also. There's a lot of really good things coming out of Britain and the UK, where they've been recruiting, patient partners for different research. For myself with Cochrane, we have a rapid response consumer group, and we've got 108 people who've signed up from all over the world to get involved in rapid reviews, and we've matched them with researchers. But all those things are done because there are well-established networks that were able to quickly go into action, and those networks were able to get multi-stakeholder task groups going. So patients talking to patients over and over again, like we don't really have any power. Like we can keep talking to each other, but we really need to be partnering with the people who can make things move, and that's just the reality of the situation right now. Hopefully that will change in the future. So I have seen a lot of talk. I've seen a lot of different opportunities now that are coming up on social media, looking for people. It's really important to get the diversity, like to get the vulnerable people, to get all the people that are affected. And, one of the ways to do that is to get people who have experience and ask them to mentor new people. And, I know a lot of patient partners, and very few would actually say no to that. They would be glad to help other people who may not be able to join in as quickly. So I have seen a change. I have seen, I try to get involved with Can COVID, which is a Canadian network. And I wrote to CIHR and said, you have no patients on the governance part of it. I did post everywhere on Can COVID. If you're looking for patient partners, contact me. I can help you. Not for me to be the partner, but for me to find them, to network with, with SPOR and et cetera, to find them partners. So there is some talk, but I haven't seen anything in Canada really, really concrete, except for the wonderful researchers, like Rebecca and the people that I partner with, who are doing it, and they're doing it because they believe in it and it's embedded and they're continuing, but it's not enough. That's my point. It's really not enough. So there's some movement, and if there's a second round of calls, which there certainly will be, let's really push SPOR to make those patient partnerships absolutely, mandatory, because obviously without that, we're not moving. We're just not getting enough people. Stop there.
Yeah, it's a challenge. Alixe, you look like you had comments to add.
Well, yeah, so I signed up for Can COVID as well, which is a Slack-based group where they're hoping to sort of put together opportunities with people who are interested in opportunities, but it does seem to lend itself more to the research community rather than to patient partners. You do have to apply, which I did, and I was accepted even as a patient partner. And there are patient partners I know that are on Can COVID, like Maureen and myself. But I have not received any invitations to be involved, and it's a little bit of a difficult site to figure out for a patient partner, as far as I'm concerned. So I think the idea is a good one, but it doesn't seem to be manifesting in a big change. I mean, in terms of the other changes, what I have seen is, of course, the calls for specific COVID-related research. And in my world, because I focus a lot on digital health, there has been, of course, with virtual care and so on, a lot of opportunities that have come. And because I have a lot of relationships in that world, again, to everybody's point, relationships are key. I've been asked to be involved in them and have been very excited to be involved in something that is so contemporary and so urgently needed. So those calls started to come in thick and fast, probably by mid-April to me, and I've had to wend my way through workload to handle them all. So that's one key thing. Is I've also noticed that on some of the projects that I've been on that don't relate to COVID particularly, quite apart from rejigging it, there's been a lot of funding decisions to push the deadlines. And so the work has just now ground to a sort of a slow but steady move forward. It's not stopped, but it's grinding slowly. So I think those are some of the big changes that I've seen. But I think amongst those changes, there's huge opportunities, especially because of the nature of the research in the digital world. I mean, we've seen already in Ontario, we've been hoping for, planning for, and urging the move to virtual care, particularly in primary care. And for that, you needed billing codes. And so we have been pushing for it for about 5 years, and we got the billing codes in 2 weeks. So one big change we learned is that when people have a fire underneath them, they can actually make decisions and make things happen. So in that sense, the pandemic gives us a huge opportunity in research to inform decisions that can be made more quickly, and there can be more impact. So maybe I'm an optimist, but that I do see that there's some opportunities there. Excellent.
Rebecca, want to build on the optimism?
Sure, I might jump in. I think that you're right, that there are some opportunities. It's been exciting to see that there, things that seemed impossible to change have quickly changed. So I think we've seen a lot of progress on things that were nuts that people just couldn't seem to crack. And so I think that that's an opportunity and will change the way that, for example, care is delivered going forward. The rapid shifts to virtual care, I don't think they're going to go away, because some of the barriers that kept from moving to those routes are, or moving to delivering in those ways, have already been surpassed or overcome. One of the other things I wanted to pick up on that you said was about the push deadlines. So, and I think that one of the challenges already, I think, if I were on the partnered side of the research, I always think that researcher timelines, like the timelines to implement, like we get people who are excited about an issue and say, you know what, this is important. It's important now. It's not important like a year, 3 years, 4 years from now. Like it needs to be addressed right now. And then, so you engage people, and then the timelines that get pushed back on the research, or opportunities that just kind of dissolve or disappear, I think that creates a bit of a challenge. So maybe that's not the optimistic point you were hoping for, but I think those deadlines do have impacts on our relationships. And I think another thing that's really important, and hopefully people have figured this out, but even if, I think our partners have been really, they're living the reality of, the impacts of COVID. They get that we're all living with it. I think what's important for those relationships that are already there is to keep the communication up. Yes, we're pausing right now, or yes, we're trying to figure out what our new direction is going to be. We'll engage you once we've figured out, once we have guidance from the university around what we can and can't do, once we, I think once we get some of the shifts in order, like on our side of things. But I think the key is keeping the communication up and not just dropping it, and people are left wondering, well, whatever happened to that project, and did it just stop altogether? So. And that's maybe going back to that theme of relationships, building, maintaining, sustaining relationships, and building a foundation for moving forward for when these new calls that come up, then there's an ability to quickly assemble that team, including partners.
Yeah, can I add something to that, Eddie?
Sure. Yeah.
So yeah, I agree with what Rebecca said. I have like, I'll say it again, I work with great researchers who are really very, very patient-centered. And one of the projects that I'm working with is with children with rare inherited metabolic diseases. The COVID has really impacted them. So a lot of them have lost all of their services at home, et cetera. And the only thing to do in that case is for the researcher not to make any assumptions about what the families want. You have to be transparent. You have to say, this is the situation. And so do you need to take a pause now, or would you like to continue? They may be at a state where, their child's progress depends on that research, and they're willing to, stay up till 2 o'clock in the morning and make comments on the research because they feel that this is what they need to do for their child. So you should never make assumptions for them, but you need to lay it out. You need to say, we understand that this is exceptionally difficult for you. Many of these children will not return to school in September, even if school does reopen, because they're immunocompromised. And then you need to give the patients who you're partnering with options. So in one of our projects, it's a multi-year, 5-year project. We've said you can leave and you can come back. Like we don't want to lose you. But the thing is, it's always transparent and discussion. Never, well, I'm the researcher and I think this is too hard for these people. So I participated in a rapid review and I had 6 hours to give my feedback. But I had been warned ahead of time that it would be rapid. And when they meant rapid, they meant half a day. I agreed to that. I could have said no. I agreed to it. And I was glad to do it. And some of the comments that I made it into the article that's in Lancet. But that's something that I was told about and I thought it was important. And fortunately, I could do that. But what Rebecca is saying is also true, that we are going to eliminate a lot of people because not everyone has that, is able to do it at short notice, or to, hold down a full-time job, take care of their children and participate in research. And that's what we need to work out in what's coming now. That wasn't something we could work out in the first 3 months. This is what we need to work out now. Now we need to say, this is going to go on for years. There's going to be health systems research. There's going to be health policy research and clinical research going on for years. And now we need to stop and really re-examine everything so that we have that diversity, because it can't be people like me who are involved all the time. But people like me can help other people to be involved. We're willing to do that, but you need to really examine the whole area and see where the gaps are, because it's wrong for a small group of Canadians to be involved in multiple projects. You really need a diversity.
Yeah, great. I'm gonna take this opportunity for not just having a small group of discussants, but also to launch a quick poll on challenges and opportunities, as we've just been talking about. So I've put up some challenges and opportunities that reflect the conversation that we've had and reflect things that have been out there in the world. Just want you to have a look and choose as many of these as you like. What do you see as some of these major challenges from your point of view in light of COVID-19? So feel free to sort of click on the ones that you think are important issues to make sure we address, just so we can get a feel for where more than just Maureen, Alixe and Rebecca are coming from. So I'm going to leave this going for about another 30 seconds or so, just to give people a chance to have a look through and sort of pick out things they think are important. I'm just going to take one of the questions and throw it at Rebecca, just from the chat box, around how to include racialized groups in engagement strategies. I know that you've had challenges in including different groups in the work that you've been doing, Rebecca. So some thoughts on making sure that racialized groups are part of these engagement approaches.
Yeah, I mean, I think that's a recognized challenge. It's an ongoing challenge, I think. One of the things, maybe I can speak to a little bit, so through the Collaborative for Health and Aging, we've been doing a review of the literature on patient engagement to look at engagement processes with older adults, so looking at both implementation and impact. And what we saw there, and although I would say overall there was a bit of an underreporting of who the patient partners are, even in general terms, to reflect their characteristics, but we did see, only probably about a quarter of those studies reported on inclusion, like equity, diversity, and inclusion indicators, I would say. And then I think in our own research, I think historically our partnership has not, we're challenged to think about how to really engage diverse perspectives. And I think we do a little bit better with thinking about gendered perspectives, and probably a little less so with ethnocultural diversity. For one of our studies right now that's being implemented in Ontario and Quebec and Prince Edward Island, We certainly were looking at engaging ethnoculturally diverse partners, in particular in our Toronto and Scarborough sites and our community advisory boards, to try to think about how those areas are really ethnoculturally diverse. So we wanted to have partners that were reflected, had insights into those perspectives, within their community. So, but it's not easy, definitely, but trying to be really thoughtful and purposeful about it, and not just sort of shy away from it because it's hard or more challenging. And one thing I would say is that we've really reached out through for example, through partner organizations. So some of our community partners, the community health centers, or the social services that we also work with, because we tend to have in our advisory boards a mix of professional perspectives and patient and caregiver perspectives. And so sometimes they've been helpful in reaching out to people in their own communities that they know who might be able to bring that a particular voice to the table.
Great. I want to jump onto the next thing, which is around lessons we can learn and sort of how we can move this forward into the future of patient partnership for research in Ontario. What can we take forward from this? We'll go to Maureen.
Sorry, I think the biggest lesson we can learn is that the system wasn't the fact that we thought that we were embedded was not really accurate, and that now we need to look at all the lessons learned from when we hit a crisis situation and find solutions to them. And I believe that in Canada we can find those solutions. I'm an internal optimist, so even though I sounded very negative, I'm an internal optimist, and I think that there are solutions. But I think it needs leadership, but it doesn't just need leadership from the patient community. We need partners who are also going to be there with us to advance this. So again, working in silos is not helping us, because we need to be empowered, and we have to find the ways to be empowered so that we can make sure that when there's an event such as this pandemic, that is a no-brainer, that it should have been incredible patient engagement, that we're going to be ready for that. And I think it's all about, it's not just we built individual relationships, but we need to have more institutional relationships that are really going to, advance that.
Alixe?
Yes, so I totally agree with you, Maureen. One thing I was thinking of is the whole suffragist movement. Women did not have any power. They had to rely on men to give them power. I think we're not in a dissimilar situation. We have no power. We need to rely on the funders and the research community and the policymakers to pass us power, and then we can take it and run with it. So I would just say that that's a bit of an analogy that I want to put together. The other thing that I've noted, and this is outside research, it really comes to the COVID tables that I've been on, and one thing that has astounded me has been the huge breaking down of silos with the development of new relationships across these silos, from the hospitals to the long-term care, where in a heartbeat they turned around and helped. And there is this sort of whole cultural shift that's happened, because people are talking to each other who have never done so before. And I think this is something that can be leveraged in the research community. We now aren't going to be talking to discrete stakeholders over here, over there. We can actually talk to communities of stakeholders who have, through COVID, learned to work together. And what can we learn from that? And what can we take that into research and then inform the decision making to basically enable that in going forward, so it doesn't fall by the wayside when we catch our breath. I won't say after this pandemic, I somehow think it's going to go on, but we will catch our breath at some point and try and go back to a new normal of some sort. There's a lot to be learned from that, and it was astounding to me what could be accomplished when these things happened. And so, like Maureen, I am an optimist. I think there's a lot of opportunity, and not to be too much of a rainbow, but that was something I wanted to say. The other thing I wanted to raise is that PAN, the Patient Advisors Network, has been working closely with the Center for Digital Health Evaluation on their evaluation projects. And with the start of COVID, those that were in train continued. Those that were a twinkle in the eye were halted. And then there was a new one stood up specifically to address COVID, to take advantage of these kinds of opportunities. And so we did that pivot at that time. And it's a bit of an aside, but I just wanted to raise that. Okay.
Yeah, Rebecca.
I think that through all of this, you know, one of the things that we realize, and maybe thinking about what Maureen and Alixe have just said, I think there's no denying how interconnected we all are through all of this. You know, and, you know, when we have siloed systems, when we're not working well together, we see where the gaps are and the gaps widen. Existing issues are exacerbated. I think, you know, the social justice lens, you know, we see the differential impacts of COVID-19 and who's included and who's adversely impacted or disproportionately impacted by some of the issues. I think all of that, you know, I think this whole pandemic has shed light and been sort of a call for action. And I think it's a call for action to hear all of those voices. And unless we sort of, I think we're best when we're working together. And unless we do that in a collaborative way and in a thoughtful way, you know, then it's, you know, then we all lose out in that. And I think the partnership perspective really helps us to better understand, you know, sometimes there are things we might think that something's an issue and we may be a little bit on the right track, but there are always things that we wouldn't have thought about that our partners bring to the table, our patient partners, our caregiver partners. They, you know, and I think as well, something that, you know, whenever I'm talking about this, I think it's really important that for researchers to think about, you know, if you only see Maureen or Alixe as a patient partner, or, you know, as the limit that they're in this box, that's all that they can offer, then you're actually limiting the impact that your project can have or the contributions that they can make because they come with these rich world experiences and, you know, and their interconnectedness with other projects, with other systems. They've overcome different challenges. Like, so I think it's really recognizing all the strength and all the expertise that can be brought to the table by your patient partners.
Great. Thank you. And either Maureen or Alixe, do you want to build on any of that? Yeah, Alixe?
Yes, I just wanted to tackle this business of bringing other patient partners to the table that are not customarily heard from. I've had lots of conversations over the years with people, well, you know, how do we talk to the homeless, or where do we go for, you know, people who are disadvantaged or don't speak English, et cetera, et cetera. And I've always said, well, you go to where they are. But with COVID, that presents a whole new challenge because, you know, physically going to where people are is fraught at the moment. So how do we do that? And I think it's going to require much more effort to establish what will have to be initially virtual relationships with the communities, and there are communities around these different groups of people. And I think we have to stay away from the thinking that we're going to invite them in to the way we do it, where we do it, and how we do it. Is there a way that we can actually go to people and say, what's the deal with you, and how would you like to do this, and what's important to you, and how would you like to work? It's more like community-based research, and I think we need to move to that. I think it needs to rise up a bit more on the status scale, if you will, and be much more thought about, because I think that's where we need to go if we're going to be looking at research with different communities than is usually the case. And Maureen is absolutely right. People like herself and myself, who are sort of around the block, if you will, and being a patient partner, could very much be sort of mentors and co-partners and facilitators in some way for this work, so that we can reach out and and find new ways. And I'm pleased to say that actually a researcher about a month ago reached out to me, and this is exactly what she wants to tackle. So I'm actually involved in the work that she's doing, and I think it's critical, particularly at this time. If we can do it during COVID, then we're golden, because we can do it at any time.
I'm gonna launch another poll just quickly on this very issue around sort of the future for patient-partnered research in light of this, including that issue around community-level approaches. So some of the things that, again, that you've heard, some of the other ideas that have come out of various literature that's been floating around that people have been writing and blogging about online. So if you can just, again, as many choices as you like, feel free to identify the things that you think are important for the future of patient-partnered research. Some of them are positive, some of them might be a challenge. So take a look through some of those issues and identify what you think are things that are important to deal with.
Maybe while we're waiting for the poll results, I just thought I'd jump in because I find the language coming out around power, the feeling of having to be given power or to be invited in, I just find that so worrisome. It really seems to be, going back to that point of undermining the potential contributions and the value and partnership, true partnership. And so it's like, I think we need to really really tackle those issues and think about how we can do better in the research community.
Yeah, that's a great point.
Yeah, I think one of the things that we can do now that the initial 3-4 months have passed is look across Canada at what has been done successfully. So for example, in Quebec, they launched a task force for patient and public involvement very quickly. And they did that very successfully. I know there's been a lot of work done in BC also. We should be looking at different case studies and what did they do and how did that work? And let's evaluate that, because we could be learning from each other. There are pockets across the country of some excellent engagement, and we can't, like, we have to look at those. We can't, we have to look at what's not working, but we have to look at what's working too. And I think that's, that's going to be really important, because we're going to be in this for years now. So
this is great. There's lots of comments in the chat box around some of the great things that are going on elsewhere. Colleen McGavin in BC has identified the town hall, COVID town hall that's going on later for BC that people are able to join in as well, virtual town hall. That there are opportunities from other support units as well outside Ontario, if you're outside Ontario, to learn more about how to get involved in your province. And I really want to thank Alixe, Maureen and Rebecca for being involved in this conversation. I think it's been a really valuable conversation. I'm really glad that there's been so much active chat in the box as well. I apologize, there hasn't been a lot of opportunity to bring people in. There's lots of stuff that we could do this for hours and hours on end. I do want to very quickly just share my screen again and give people an opportunity to just know about two other things that are going on. One is that the Ontario Sport Support Unit, if you're a researcher in Ontario or you're a patient partner in Ontario and you have interest in something, there is a new funding opportunity that we're putting out that's just started, which is these things called Empower Awards, which is to try and take things that are patient partnered, so taking all that valuable work that we've been doing and working out how to get it into action and impact in Ontario, and in particularly in this case around how to relate it to COVID. So please do take a look at our website and have a look at that opportunity, and do consider, even if you're a patient partner and you do think you have an idea for something, that do contact us. We can maybe find the right researchers to put you in touch with to make these things happen. And the other thing is I want to do a quick plug for an excellent podcast that we've had a hand in funding, but had very little hand in actually telling people what to talk about, which is this Matters of Engagement podcast that Jennifer, who may or may not still be on, is leading with my brain is totally blanking and I can't see it because it's behind the screen. Anyway, this great piece of work, lots of great podcasts, lots of content.
Emily.
Jennifer, yes, Emily, sorry. Please do take a chance to go and take a look and a listen to the Matters of Engagement podcast. Fascinating conversations going on and really deep challenges to the way that we understand issues. So I do want to do a quick plug for that. Thank you so much to everybody for taking the time to come and be part of this work, be part of this webinar. We really do appreciate this, and we will be taking a lot of these ideas and trying to push them forward to try and make this really the cornerstone of COVID research and also other patient-partnered research that goes on in Ontario and beyond, so that this isn't something that gets lost and we do really grab these opportunities. So thank you to everybody. I look forward to being able to engage with you again in the very near future. Take care and have a great day.